Assalamu alaikum. Hi everyone. I will talk here about the facial nerve. Facial nerve is the seventh of the cranial nerve, derived from the second brachial arch from embryology. Okay? There is two components, motor component and sensory component of the facial nerve. The motor component will stimulate the facial of muscle expression, and for innervating of the stapedius muscle in the inner ear to protect the ear from loud voices. And then is stylohyoid muscle, posterior belly of digastric muscle, and the last is posterior auricular muscle. Okay, the sensory component is innervating the anterior two-third. This is two-third of the tongue. Taste, sensation. Okay, and for the ear, okay, external auditory meatus for pain, touch, temperature. Okay, then we go to this part. Here is the facial nuclei. Here is the abducens nerve, which is not a facial nuclei, it's just the sixth nerve of the cranial nerve. This one is the facial nucleus, and this green one is called superior salivatory nucleus, and the brown here is called Trunctus solitarius nucleus, and the blue one here is called spinal nucleus of trigeminal nerve. It's called spinal nucleus of trigeminal nerve. Okay, so here is in the level of the pons. This is the pons. Okay, the facial nerve is inferior part of the pons at the level of the fourth ventricle. This is the fourth ventricle, and the tegmentum. Okay, this is the tegmentum here. So I will show you the fibers, how it goes. Okay, the facial nerve firstly will go posteriorly, looping around the abducens nerve, creating the facial colliculus, and then continue its tract into pontomedullary. This is called pontomedullary junction. Pontomedullary junction. And superior salivatory nucleus goes with it. Okay. Also, this fiber from Trunctus solitarius and spinal nucleus of vagus. So all this creating as a one bundle called nervus intermedius. One bundle nerve, called nervus intermedius. All of these fibers as a one bundle enter into a canal called internal acoustic meatus. Okay, here I will show you the internal acoustic meatus. What is it? So this is the hypoglossal foramen. This is the jugular foramen. This is the foramen ovale. This is foramen spinosum. This is foramen rotundum. And here is superior orbital fissure. Where is internal acoustic meatus? This is here is internal acoustic meatus. Okay, Now let's see and continue the facial motor branch. So this is the facial nerve. I will continue it course. Okay? But before that, I will show you the facial nerve. Where is it? This is the facial nerve looping around the abductor nerve. This is the abductor nerve, which is the sixth nerve, and then it's entering into pontomedullary junction. Okay? Now here is the facial nerve. I'll just make a big bundle here. This is the genome. There's the facial nerve. Okay? So the facial nerve, now we said it's continue from internal orbital fissure, internal acoustic meatus, sorry, and it's entering here. Does not synapse in the geniculate ganglion. This is called what? The geniculate ganglion. By the way, this is the inner ear. This is the anterior wall here, and this is the medial wall, and this here is the posterior wall. Okay, and laterally is the tympanic membrane. This is the inner structures. So let's continue. The facial nerve does not synapse. Okay, and continue in the facial canal. This is called what? The facial canal. Facial canal. Continue the course to innervate the stapedius muscle. Okay, this is the stapedius muscle right there. Okay. Now we continue its course down there till it reach a foramen. Here's the mastoid, and here is the styloid. This is called here stylomastoid foramen. Stylomastoid foramen. Okay, entering this. So it will give a branch to posterior auricle, okay, and a branch to posterior belly of digastric muscle. Give a branch to stylohyoid muscle. Okay, stylohyoid muscle. Also continue here. So this is the skull. By the way, this is the lateral ear, the inner ear. Okay? So this is the mastoid, and here is the styloid, and this is the facial nerve. Comes from there and give branch. Does not innervate the parotid. This is the parotid gland. Does not innervate the parotid gland. Just give a branches to facial muscles. Give here called temporalis. Here is zygomatic. Here is buccal, marginal, and the last one is cervical. By that we finish the innervation, motor innervation of the facial nerve. Now we continue. Okay. This is superior salivatory nucleus, right? And give two parts. There is lacrimal and there is salivatory. There. This is salivatory part, okay? So we will see the lacrimal part. The lacrimal part will enter internal acoustic meatus. From there, does not synapse in the genome, but jump. Jump where? Where to jump? So, is jumping. It's called the greater Petrosal nerve, which is a parasympathetic innervation, entering into a foramen lacerum and synapse in the sphenopalatine ganglion. Synapse in the sphenopalatine ganglion. This is the internal carotid artery. Give a plexus, sympathetic plexus, okay, accompany the greater petrosal. This plexus this nerve of sympathetic part called the deep petrosal nerve. Deep petrosal nerve. So we'll accompany the greater petrosal in the foramen lacerum. This is foramen lacerum. Okay, it will accompany it. Does not synapse in the sphenopalatine ganglion. So this is sphenopalatine ganglion here. And this is called petrigopalatine fossa. Okay, this all here, right there, is called petrigopalatine fossa. Now, the greater petrosal will accompany a nerve called maxillary nerve. Where's this maxillary nerve? This is the maxillary nerve. Maxillary nerve comes from the trigeminal nerve, comes from trigeminal ganglion, okay, to give maxillary nerve as a branch. The maxillary will enter into foramen rotundum and will enter into the sphenopalatine ganglion. From this point, the greater petrosal nerve will synapse in there and enter into inferior orbital fissure. This is called inferior, this is fissure here, called inferior orbital fissure. Okay? Now, this greater petrosal will enter into the branch of the maxillary nerve called zygomatic nerve. Zygomatic nerve. This is the zygomatic nerve, okay? So this is the zygomatic nerve entering into lacrimal nerve. Where's this lacrimal nerve come from? Okay, the lacrimal nerve come from, this is the ophthalmic nerve. Ophthalmic nerve is a branch from trigeminal nerve. The fifth nerve is trigeminal nerve. Ophthalmic nerve is a branch of it. This nerve entered to superior orbital fissure. We showed you before, superior orbital fissure. And this ophthalmic nerve will give lacrimal, give a branch called lacrimal nerve. Okay, this is the lacrimal nerve. Greater petrosal nerve will continue to enter the lacrimal gland. This is the lacrimal gland. Okay? The sympathetic part of the deep petrosal nerve does not synapse, enter, accompany the greater petrosal to the lacrimal gland as a sympathetic innervation. Okay? That's it for this part, and we're gonna see the salivatory part. Okay, the salivatory part we'll continue. This is also a parasympathetic. Okay? Now this fiber is the salivation part. Does not synapse in the geniculate ganglion. While entering into the facial canal. From facial canal, now, okay, the medial wall, then the posterior wall, but does not exit through stylomastoid foramen. Rather, it goes to the chordae tympani. Chordae tympani. This is the nerve called chordae tympani. Okay? This is an imaginary line till enter to pterygotympanic fissure. Just for that, I will show you the facial nerve. This is the facial nerve. Enter into internal acoustic meatus, forming geniculate ganglion. Geniculate ganglion, there will be greater petrosal getting out. Enter, this is the facial canal. So, innervation of muscle fossa Meatus. Here is the chordae tympani. It's cut out because this is not the way for the chordae tympani. It should be above the tympanic membrane, between the incus and the malleus. Okay? So it's entering here, between the incus and the malleus, entering into pterygotympanic fissure. Pterygotympanic fissure. Now, once it entered to the pterygotympanic fissure, we'll continue its journey. This is a pterygotympanic fissure. This is the chordae tympani. Now, it joins a nerve. This nerve is mandibular nerve. This is the mandibular nerve. Mandibular nerve is a branch from the trigeminal nerve, entering into a foramen called foramen oval. Foramen oval. Mandibular nerve will give a branch called lingual nerve. And lingual nerve will diffuse with the chordae tympani. Okay, this is called the lingual nerve. Will diffuse with the chordae tympani, and chordae tympani, this fiber, especially the salivatory fiber, will continue till it's find its ganglion and synapse in there. What does ganglion called? Submandibular ganglion. Submandibular ganglion. When synapse in there, it's innervate two glands. Submandibular, this is submandibular gland, and sublingual gland. Okay? That's it for the salivatory part. We can move back again. So we finish from this tract. Now continue. This is tractus solitarius, right? We will continue the journey. Again. Inferior orbital fissure. Entering there. Okay. Now it's synapsing in the geniculate ganglion. Tractus solitarius is sensory part. Synapse in the geniculate ganglion. Okay? Once it synapse from the geniculate ganglion, it continue its journey. But entering into chordae tympani nerve, and goes accompany with the parasympathetic innervation to the salivatory gland. Okay? accompany with it. Petricotympanic fissure goes down in there. Lingual nerve. From lingual nerve, we continue with the lingual nerve. Okay? Continue with the lingual nerve to innervate what? Anterior 2/3 of the tongue. But for what? For sensation. Taste sensation. Okay? This is for tractus solitarius, sensation of the anterior 2/3 of the tongue. Okay, now we finish from this part. Last one is spinal nucleus of trigeminal. To be continued. Okay, again, here. I hope you see it, but I'm gonna make it a little bit bigger so you can see it. So this is the trigeminal. Yes, it's also synapse in the geniculate ganglion. This is called the central part from it. This is central. And here is the peripheral. The peripheral part, we continue down from facial canal, from the medial wall to the posterior wall. Exit into the stylomastoid foramen. Okay, from stylomastoid its exit to innervate the ear. Okay, external auditory meatus for pain, touch. Okay, pain, touch, and temperature. Okay, this is for the spinal trigeminal nucleus for the facial nerve. That's all about the facial nerve, and thank you for good listening.